Sometimes you meet patients with edema in the breast area due to injury or after breast cancer or even after radiation. Then you need to do the bandaging over the breast to reduce the swelling. You start under the breast area and you follow with the bandage around the patient, and you overlap with the bandage 2 times, and then you start by doing the bandages under the breast of the patient. You need to be very, very careful near the armpit because this skin here is very soft. You can use some extra material to avoid any scarring in the skin. And this you can do on one side and even on the other side. Then you're continuing with the bandaging over the breast. Stretch the bandage a little bit, not too much. And when you need to change the roller, please ask the patient for some help. Could you hold this, please? Then I take the next one on top of the end of the first one. Please hold this. And I go over the breast. Press a little bit on the back. Again, now I secure this one and I go over the breast again, like this. Be careful with the armpit. And the last one I cover on top of the breast. Now we are doing the final one over the breast, and we have already made tape to fasten the bandage with. And then you need to ask the patient how it feels, because this is also pressure over the lungs, so the patient has no problem with the breathing. And if it's okay with the patient, then you leave it on for more than 24 hours.